Renal questions 1. 1. The client is scheduled for surgical creation of an internal arteriovenous fistula of the following day. The client says to the nurse, I will be so happy when the fistula is made tomorrow. This means I can have that other hemodialysis catheter pulled right out. The nurse interprets that the client 1 does not understand that the site need to mature or develop for 1 to 2 weeks before use. 2. Has an accurate understanding of the procedure and aftercare. 3. Does not realize how painful removal of the dialysis catheter will be. 4. Is not aware that the alternate access site is left in place prophylactically for 2 months. The correct answer is 1. Do not use that the site needs to mature or develop for 1 to 2 weeks before use. 2. The client with renal cell carcinoma of the kidney is scheduled for nephrectomy. The kidney appears normal at this time. The client is anxious about whether dialysis ultimately will be necessity. The nurse would plan to use which information is discussion with the client. 1. The client has absolutely no chance of needing dialysis because of the nature of the surgery. 2. Dialysis could become likely, but it depends on how well the client complies with fluid restriction after surgery. 3. One kidney is adequate to need of the body as long as it normal function. 4. A strong likelihood exists that the client will need dialysis within 5 to 10 years. The correct answer is 3. One kidney is adequate to meet the needs of the body as long as it has normal function. 3. A nursing student is caring for an older client with a diagnosis of benign prostatic hyperplasia. The nursing instructor asks the student to identify the clinical manifestation associated with the condition. The student needs to further research the condition if the student stated that which of the following was the early symptoms of benign prostatic hyperplasia. 1. Orchiria. 2. Decreased force of urine stream. 3. Difficulty initiating of urine stream. 4. Hematuria. The correct answer is 4. Hematuria. For the client with renal cancer is to undergo preoperative renal artery embolization. The nurse reinforces the primary benefit of the procedure by explaining the client 1. This will prevent the risk of pulmonary embolism by occluding the renal artery and its branches. 2. This will shrink the tumor because its blood supply will be removed after placement of an absorbable gelatin sponge. 3. The procedure will reduce the time need for surgery by the least of because it provides hemostasis. 4. This will cause the tumor become tougher and easier to resect in surgery with the scalpel. The correct answer is 2. This will shrink the tumor because its blood supply will be removed after the placement of absorbable gelatin sponge. 5. The nurse is monitoring a client who just returned from surgery following transurethral resection of the prostate. The client has bladder irrigation running via 3-way Foley catheter. The nurse is observing the color of the urine and would expect which of the following during the immediate postoperative period. 1. Bright red color with small clots in the urine. 2. A pale pink color urine. 3. Tea color urine. 4. A dark pink color urine. The correct answer is 2. A pale pink color urine.